Hello everyone, welcome to Dentospedia, which is the most trusted platform for any dental board exam. So today I'm going to teach you a short topic on bacterial infections of the oral cavity. So let's begin with the topic. First is bacterial infection causing oral ulcer. Now first is syphilis, which is caused by Treponema pallidum, which is a spirochete bacteria. Understand, the causative organism is Treponema pallidum. Please remember this name of bacteria. Understand? So it is caused by Treponema pallidum, which is a spirochete bacteria. This is a spiral shaped bacteria. Now mode of transmission is sexual contact. So, syphilis progresses through three stages, now each with characteristic and finding. So, first is primary syphilis. So, see, it is a single painless ulcer at the site of infection. Now, common oral sites are lip or tongue. Now, characteristics will be there will be a firm base and clean margins, and it will be a non-tender. Understood? Now see, it appears about 3 weeks after infection and it can heal spontaneously in 3 to 6 weeks even without treatment. So healing does not mean that the disease is cured. So it is a painless Chancre ulcer at the site of infection. Now it resolves in 3 to 6 weeks even without treatment. Understand? The ulcer is called Chancre ulcer. Now next is secondary stage or secondary syphilis. See, occurs weeks to months after the primary stage due to systemic spread. Now oral features will be there will be a mucus patch. There will be mucus patches. Now it is painless white plaque on the tongue and buccal mucosa. Understood? The mucus patch will be painless and it will be white or grayish plaques. Now it is common in tongue or buccal mucosa. Understood? Now there will be a condyloma latum, which is a wart-like lesion. Understand? It is a wart-like lesion and it is highly infectious. Now patient may also have skin rashes, fever, malaise or lymph node enlargement. Understand what is malaise? It is feeling of illness. Understand? Please remember these terms. Understand? There will be mucus patches and condyloma latum. Understood? Now next is tertiary syphilis. See, occurs years after untreated infection. Now oral manifestation will be gumma. See, which is very important. Understand? It is gumma. Now it is a destructive granulomatous ulcer on the tongue or palate. Understood? So gumma is a destructive granulomatous lesion. Now it is commonly affecting the palate or tongue. Now may cause palatal perforation as well. Now, systemic complications are neurosyphilis, which is a nervous system involvement. Understand? Neurosyphilis or cardiovascular complication. Understood? Now, what is the diagnosis? See, diagnosis will be confirmed using serological test. Understand? It is confirmed using serology, which is a VDRL, RPR, FTA or ABS. Understand? FTA, ABS. Then treatment involves penicillin G injection. Now drug of choice will be penicillin G injection. Now early treatment prevents progression and complication. Understood? Now you can see syphilis stage 1, there will be chancre on the lip or on the tongue. Then in stage 2, you can see mucus patches or condyloma latum. Understood? Then stage 3, there will be a gumma or palatal perforation. You can see there will be a palatal perforation. Understood? Now syphilitic ulcers are painless. In primary syphilis, the ulcer may heal on its own, but infection still persists. Understand? So if there is a painless ulcer, think of syphilis. If there is a palatal perforation, think of a tertiary syphilis. Now white, painless and plaques, think of a secondary syphilis. Understood? So this was syphilis. So that's all for bacterial infections of the oral cavity. For more detailed video, please download our app Dentospedia and please do like, share and subscribe our channel. Thank you very much.